Hello everyone, I'm Dr. Farhan Tahir. I'm a rheumatologist. I came across an interesting study today that I would like to share with you. This study looked at risk of osteoarthritis and its relationship with cardiovascular diseases. Most patients that have osteoarthritis of the hip and the knees would not know that actually this reciprocates to higher risk of cardiovascular events. I think most of the doctors even don't account these two risk factors together. A study from Canada looked at patients who had osteoarthritis of the hip and the knees. They counted the amount of arthritis joints that they had at one point, and they associated them with cardiovascular events that happened during the follow-up period. They found out that patients who had two or more joints of osteoarthritis actually had significantly higher risk of cardiovascular events compared to patients who did not have arthritis. Two joints, either hip or knee arthritis, was equal to about 13% higher risk of cardiovascular events. But if patients had three or more joints involved, risk was about 22%. The study also pointed out that women had higher risk of osteoarthritis compared to men. This risk factor was completely gone if patients did not have difficulty with ambulation. So meaning arthritis, which is causing difficulty with ambulation, is the factor that leads to cardiovascular diseases. This goes back to the same concept that if you're not physically active, whether you have arthritis or not, increases your risk of cardiovascular events. This study found out that actually having osteoarthritis of three or more joints is equal to having a cardiovascular disease risk factors such as diabetes, hyperlipidemia or atherosclerotic disease, or hypertension. So osteoarthritis now falls into the same category of diseases that actually increases risk of heart events or cardiovascular events. These patients were followed for several years and found out they had significant amount of stroke episodes. They had cardiovascular events such as myocardial infarction, angina, and as well as congestive heart failure. So if you or your loved ones have difficulty ambulation because of arthritis, please get evaluated so that you can reduce your risk of cardiovascular events in the future. I hope you will find this useful. I wish you best of luck for your health and wellness.